Cholera cases have drastically reduced in Kiambu County after weeks of heightened fear among residents. While Kiambu had been rated number 1 having reported over 10 cases, the number of those affected have continued to diminish following major interventions by the devolved government. According to Tarisia Wanjiru, who is the County Director of Public Health and Sanitation, the county has been at the forefront in taming the bacterial disease causing severe diarrhea and dehydration, usually spread in water.
Yetu tukiwa CHV inakuaga tu tuko na zile household kama kwa saa hii tunawapatia hizo water guards za kutengeneza maji, kwa sababu like now we have rationing of water, so maji kikuja inakuja ikiwa na uchafu. Kwanza leo tumefurahi kwa vile tulikuwa na hiyo wakati muhimu wa kujua umaana wa choo, so tukirudi kwa mashinani tutawahimiza jinsi ya kutumia choo vizuri.
Wanjiru says that following the outbreak last month, the county of Kiambu has since deployed response activities including field investigations, enhanced surveillance, lab testing, case management, risk communication, community engagement, and environment sanitation to help manage the outbreak.
Basically, we realize that when you talk about young people, you happen to be the largest population in Kenya, and that is not any different in Kiambu County, deducing from the national population. And that basically means that we are actually highly affected, given that it's the young people that you'll find in schools, that is from the age of 10 years actually to 24 years, which means that we as young people, we really need to understand the importance of toilets in our society.
We are really excited today. We were commemorating the World Toilet Day. And when we talk about toilet, we know it is about sanitation. As a county, we are celebrating this when we had issues of cholera, but we want to thank our government, the Kiambu County government, because following the outbreak, a task force was formed. We've been able to reach many people in the community, and today was a great day because we were able to create awareness where we brought on board our institutions, the primary schools, our adolescent and young people, and also our community members, so that we can be able to pass this message to them. So we are happy because the way the message was demonstrated, it seems that the community now is really aware of what is happening. You know, the community health volunteers have various households that they work in, and they normally visit there on daily basis. And for us to combat cholera, we have to start at the household level. We've realized that through the community health volunteers, the community members are aware and they are able to report when they see these signs, and this way we are able to combat the disease. That is why you realize currently, even we have been able, our numbers are going down. We used to be rated number 1, but we are number 4, and we believe that we'll be out of that list soon.
May have been reported in Kiambu, but probably it may have originated from elsewhere, because this was just an event in Kiambu. So we have other counties also which are involved. We have around 9 counties so far, and what we are doing is that we are supporting those counties with commodities, with technical experts, and also we are visiting them just to encourage them, so that we are able to have the cases really go down and not for the situation to explode. We are having a national task force, and all the counties are involved. We meet daily, Adam? Yes. We meet on a daily basis just to be able to figure out where we are as a country, and also to be able to be updated on where the counties are on a daily basis, so that we can plan any activity that needs to be done, any other mitigative actions that need to be done. We can evaluate and see the next step that needs to be taken. My message to Kenyans is to embrace the toilets, not just to construct it, but actually to construct it and make use of it. I would also want to give this message to Kenyans. We saw the benefits of going back to basics during the COVID period. The basics are what? Hand washing, keeping distance, wearing the mask. In this case of cholera, hand washing comes in quite handy. So it's very important that we continue practicing the hand washing bit with soap and running water. It is also important that we make sure that the water that we are taking is quite safe. It's also important that we also make sure that the food that we are taking is also safe, well prepared, well stored, and well taken.